and welcome to Senior Moments. This is a show all about senior living here in Cleveland County. I am Jackie Sibley Newton, your host, and this is a broadcast service of Cleveland Community College found on C19. You can also watch it on c19.tv, so I hope that you'll share it with friends and family. Today our guest is Dr. Josh Yelverton with ENT Carolina.
Hi.
Welcome to the show.
Hi. Thank you. Thank you for having me.
You're welcome. I'm glad to have you here. One of the things that you do is deal with hearing loss.
Yes,
and
ma'am.
I know hearing loss among senior citizens, it's really benevolent through all age groups, but through senior citizens, it's a little bit more of a challenge for them.
Yes, it can be. It affects a very large portion of the population, especially the more senior they get, the more often it is to happen, especially in this part of the woods where people do a lot of hunting and they have other forms of noise exposure. We see a fair bit of hearing loss.
And with senior citizens, is it a natural part of aging to lose hearing?
Yes, it's completely natural. It's just like with vision. As you get older, your vision tends to fail. As you get older, your hearing tends to fail. Sometimes that's genetic, where you has a family history of it, but sometimes it just happens as we age.
What are some of the most common causes of hearing loss?
Like I said, some of it is just it's going to happen no matter what. Other parts are you can have a cold or a virus that kind of decreases your hearing. You could have head injuries that decrease hearing. But most of the time it's just good old-fashioned, I've gotten older and my hearing has just declined as I've gotten older.
Right. And is the hearing aid always a solution?
No, it's not. The hearing aids can be a solution for people when it comes to hearing loss, but it is not always, as one would say, the magic bullet. When it comes to hearing, there's a couple of different parts to it. There's hearing a noise, such as like hearing a beep, or I know this person's talking and I can hear them making a noise, but I can't understand them. Then you have the understanding part of hearing loss. And that's really where you kind of get into the nuance of will a hearing aid help or will it not?
And that's just really determined through hearing tests and
it is.
determining what works.
One of the analogies that I will sometimes use with my patients is for any of those that have watched Charlie Brown. You can make Charlie Brown's teacher as loud as you want, and it will always be want,
Yeah.
right? And so as your hearing gets worse, what we call your discrimination score, or your understanding ability, can decline. And for those people, hearing aids may not be the answer, but we can kind of ferret that out by doing a hearing test.
And people who have, say, like for me, for instance, I can't hear when I'm in a large group. If you put me in a restaurant setting where people are talking around me, I can't hear what the waitress is saying to me. I can't hear what the person across. Is that something that is common? Is that correctable?
Right, so that's the thing that we see. People most commonly will come in and they'll say, listen, I'm having a hard time understanding my friends that I eat breakfast with every Tuesday at Waffle House, or I'm having trouble understanding the preacher at church or in the grocery store. And so yeah, that's the most common, or it'll be a man whose wife is sitting behind him and he says, I don't have any hearing problems. And his wife is sitting back there vehemently shaking her head that they do. And so yeah, those are kind of common things that we will see bringing them in. And then, like you said, they are aidable at times, but not always.
So the folks who are able to receive help through a hearing aid, let's walk through what that looks like for them.
So like you said, those people generally come in and the complaint is usually one of two things. One is my wife is complaining about me, or I'm having trouble hearing people. The second can be ringing. Hey, I have this ringing, buzzing, a cricket noise. Occasionally we'll have people that say they hear music, but they'll have something that's called tinnitus, which is basically the brain making up noise that it's not getting anymore.
Okay.
And so those people will come in. We will always get a hearing test for them, see what the hearing test shows, both from a ability just to hear noises at different pitches, and then we will test their understanding ability. That's where we turn up the volume, give them words to repeat back to us that are two-syllable words without any context, without any ability to read lips. And a good example is like race car, and we have you repeat that word, and we see how many of those you're getting correct. And based on that percentage, we can kind of say, yeah, hearing aids will be a home run for you, or hearing aids, they'll help you, but it might not be a home run.
Okay. And are there different kinds of hearing aids? Are there ones that just amplify,
Right.
or ones that help kind of, I don't know, break it down to where you're hearing specific things?
Sure. So, as you pointed out, not all things that claim to be hearing aids are hearing aids. You have amplifiers that do nothing but make noises louder. Those are probably going to be cheaper, and as the old saying goes, as with most things in life, you get what you pay for. Then you have other forms of hearing aids, some that go completely in the ear canal, some that come behind the ear, and then will have a little wire going around. What you would need would depend on the amount of hearing loss you have. The more hearing loss you have, the more power you need. Another facet you'll find with hearing aids is that there's different levels of programmability. A good analogy there is when you buy a car, do you buy the basic trim package, the next level up package, or the luxury package? And so generally the more expensive you get, the more programmability, the more customizability that you'll have, so that if you're mainly having trouble with low pitches, we can turn low pitches up, high pitches down, etc.
Okay.
And one of the things that people sometimes think is, you go, you see an eye doctor, you get a prescription for glasses, and those glasses, you put them on and you immediately see better. Everybody perceives sound differently. And so whenever you're working with your audiologist or hearing aid practitioner, be patient, because sometimes it takes some fine tuning and playing with those in order to be able to fully get them customized just to your hearing.
And I know that's some frustration,
It can be.
especially in senior citizens, they want that instant. This
Yes.
didn't work.
Yes, everybody wants instant.
But they have to understand that there are some adjustments that need to be done and some fine tuning to get it to where, because you
Sure.
can't hear what they're hearing.
No, you cannot. And that's, I can't speak for everyone's practices, but generally what my practice does is, if you buy the hearing aid, we'll fit them to you, and then we'll have you come back in a few weeks, and we'll say, okay, how are they going? And we'll try to play with those and change them as you are perceiving it, and we'll work with you. Make sure you whenever you buy a hearing aid, make sure you trust your audiologist, the person that's working with you, because they're going to be it's a relationship. It's a give and take, and help me here and help me there. It's a relationship is a good way to kind of think about it.
Now, I've noticed some of the newer hearing aids, people are controlling things on their cell phones.
Absolutely.
I'm not sure how all that's working.
It's
Even
Bluetooth.
senior citizens are making that work.
Yes, it's
Yeah.
Bluetooth, and it's phenomenal. I've had so many people come in that they've gotten it and they don't even take their phone out of their pocket anymore. Their hearing aid, they answer it right on their hearing aid. Their phone, any phone calls, they answer right on their hearing aid. The TV can go through your hearing aid, so that if your significant other doesn't have hearing loss and you do, your hearing aid's programmed through the TV to your volume level, and your partner can listen to the TV at theirs. It's really great to live in this time.
That's amazing,
Yeah.
because those are things I know that people with hearing loss, everybody thinks, well, it's just about conversation, but they want to be able to talk to people on the phone.
Right.
And hearing on the phone has been a challenge. And being able, I didn't know that it would adjust the television. That's exciting.
Right. It's just like, it's Bluetooth. It's exactly what it is. It's just like your car or any other thing with Bluetooth.
Yeah.
Your AirPods.
And I know that hearing aids are so tiny now,
are.
you don't even notice people have them, where the old ones were big, and you would hear them whistle sometimes. And I don't know if they still make the kinds that will whistle if they get too close to things.
Some do still whistle, and that's just the functionality of if you have something too close to it. But yeah, I see patients all the time clean out their ears and that sort of thing. And honestly, I can be right there at them, and I won't realize they have a hearing aid in, whether it's because they're so small or whether it's because, like with you, like you would never see a hearing aid in your ears because of the way you wear your hair.
My hair covers
And the color of the case on the hearing aid, we can vary that with your hair color, and it really is pretty indiscreet at this point.
That's wonderful. How about maintenance of hearing aids? How important is that? And is that a step that people often aren't taking?
Well, so with our practice, what we tend to do is we kind of sell, when we sell you the hearing aid, you have a maintenance package that comes with it. And so let's say you have wax or the hearing aid's not working. We try to steer people away from batteries. Nowadays, we try to have them do the rechargeable ones because that's one of the common complaints, or they don't want to fiddle with the little hearing aid batteries. Now we like to have people buy hearing aids that you take out of the box in the morning, put it on, and then when you go to bed at night, you take it off the ear and put it in the charger, and there's no fumbling with batteries. But back to the maintenance, they have to come in, and they'll be adjusted, and they'll be cleaned, and that sort of thing. And so when we tend to sell hearing aids at ENT Carolina, what we do is we basically sell a service package with it that every time you come in, you don't get nickeled and dimed and say, oh, it's going to be $15 to do this or $50 to do that. It's all kind of covered.
So it's kind of one-stop shopping for everything.
It is.
Excellent. How often do people come in for those kinds of adjustments and maintenance?
Once we have you in a pretty good place, usually about every 6 months to a year. It doesn't have to be all the time.
Okay.
I mean, initially, you're probably coming in once a month until we get you fine-tuned, which is maybe 3 months in, 6 months in, but it's not that bad.
That's great.
Unless you're having trouble.
Technology's come a long way.
It has come a long way, and that's another common question that we get is, well, my dad, my mom had hearing aids many years ago, and they were worthless. Technology changes. Just like when you buy a phone or buy a computer, the technology is so different today versus even 5 years ago that it's a big change. And so just don't write it off if you have a loved one that had trouble with hearing aids.
Excuse me.
It's okay. Sounds like you need an ENT.
No.
Well, we are going to take a quick break, and then we'll come right back and talk more about hearing loss.
All right. Thank you.
Killing people dying, children hurt and you hear them crying. Can you practice what you preach and would you turn the other cheek?
How you doing, Dave Mel?
Father, help us and some guidance from above. These people got me questioning. Where is the love? Where is the love? Where is the love? Where is the love?
Hi, I'm Nikki Bliss Carroll, your host for Cleveland Connections, the show that explores what's happening at Cleveland Community College. Join us as we sit down with members of faculty and staff to discuss programs of study, upcoming events, and other exciting campus news. We'll have a new show for you each month on C19 TV, or you can stream us online at c19.tv. Tune in and connect with Cleveland Community College on Cleveland Connections.
Here in Cleveland County, many children struggle to develop due to the lack of guidance and shortage of positive role models. At the Boys and Girls Club, we make it our team's mission to aid your child in becoming a better student and, more importantly, a better person with a brighter future.
When your child comes to the club, you can be assured they are being guided in a manner that is beneficial to the growth as an adult that is visible in their lives. Please consider giving your child the opportunity to be the absolute best they can possibly be.
Please support your local Boys and Girls Club today.
This week I am an old team running the second. And to my right...
Is this a European version of the show?
What just happened?
I have no idea.
On the right show?
I have no idea.
It's great to be here.
Yes, it is. We've got Temptation Eyes, Tim Foster.
Chanel 19.
Yeah, the Tim approved.
If you want to smell like Tim Foster.
Tim endorsed.
Yep.
I like it. And for those of you that do not speak Tunisian, welcome to Meet Me.
Do we want to do that again?
The movies.
Hi, I'm Shara Miller, the host of Artworks. Each month we bring to you wonderful, talented artists from here in in Cleveland County and the region. We have artists, we have potters, we have painters, we have musicians, we have actors. We just have wonderful artists that come to you and tell you about all that they're doing, their creativity, what inspires them. Join me here on Artworks each month on C19. You can also watch us online at c19.tv.
Back to Senior Moments. I'm Jackie Sibley Newton, your host, and we've been talking with Dr. Yelverton of ENT Carolina about hearing loss. One of the things that I know in senior citizens, and I see it in my work at Terabella, people have often been misdiagnosed as having dementia or cognitive issues.
Sure.
And it turns out it's more hearing loss.
Right. So sometimes as people get older, if they can't hear very well, they just go into a little bubble of isolation. And that can be dementia or memory loss, but it can be associated with hearing loss as well. Studies have shown that in patients that have mild hearing loss, there's actually a twofold risk increase of developing dementia. Moderate hearing loss is threefold, and severe hearing loss is fivefold. Furthermore, when it comes to memory loss, studies have shown that people that have hearing loss tend to develop decline in their memory abilities about 3.2 years prior to those that don't, and will suffer about a 30 to 40% decline worse than their counterparts that don't have hearing loss. The thought behind that is, you know how in the not old days, but we used to tell people to, hey, do Sudoku or do crossword puzzles as you get older, right, and as a means of neuroplasticity, to keep your brain active, to keep it moving. And the thought behind that with the hearing loss is, if you're in a bubble, if you're isolated, if you're not able to hear and process things, that part of your brain just lets it go. And so that's where the hearing loss and dementia feed in to hearing losses, because one of the ways you get input into your brain is through hearing and interaction with your friends.
It also interferes with socialization.
It does.
I know through COVID, we learned a lot about how important socialization is to longevity.
It absolutely can be. I mean, it's almost crippling, because you can't understand people, and you just go into a bubble. You know, another interesting thing we learned with COVID was how much people were depending on lip reading when it came to hearing. You couldn't read lips anymore because everybody had on a mask, and so it really unmasked the problem of hearing loss for a lot of people.
I was one of those people.
Yes.
Did not realize how much I was lip reading until everybody started wearing masks.
Right.
And I would talk and take my mask down to talk, which makes the mask ineffective.
Right.
But it's because I assumed people couldn't hear me because I couldn't hear them.
You couldn't hear them.
With them wearing the mask.
Right.
Yeah.
It was a big deal for us. People really found out, oh gosh, I really do have hearing loss.
So what do you recommend for people who, most of the time it's going to be a spouse saying, you need to go get your hearing checked,
Right.
or a child telling their parent,
Right.
go get your hearing checked. So what do you recommend for
Yeah,
the first
I would
steps?
recommend call our office, make an appointment, say, hey, I have some hearing problems. I'd like to be seen. And the first thing we'll do is we'll get you in. One of the physicians will see you. We'll make sure it's not a wax problem or an infection problem. And if your ears are clear, then we'll get you over to our audiologist at the same visit. We'll get a hearing test, and then we'll sit down with you and we'll interpret that hearing test. And for me, I print the hearing test off. I sit down there with you and I show you on the hearing test, this is what this means and this is what this means, and then we'll kind of talk through it.
Now, if you have a hearing impairment and you're wearing a hearing device,
Right.
will your hearing still continue to decline, and that needs to be
Right.
adjusted or changed?
So, yes, your hearing will decline. I will tell you that the only thing that we've ever found that will slow down the decline of hearing loss is hearing aids, is continuing to feed that part of your brain. But yes, hearing will decline at a variable rate. Some people it's 6 months, some people it's 6 years, some people it's 60 years. You never know how you're wired. but that is something we do monitor when you come in and you see our audiologist about once a year, once every 6 months. They will check that and they will see, hey, their hearing has kind of declined. We need to get you back over to the doctor and let them make sure, or hearing's pretty stable right now. We can just kind of continue on as we're doing.
Is there any medication that helps with hearing loss?
No, there's not really. The only thing that can help prevent hearing loss is noise protection, and then once there is damage and hearing loss, is going to be to continue trying to feed it by wearing hearing aids, that sort of thing. There's no magic medicines. If there was, I'd probably have a Nobel Prize and
Yeah.
be living at the beach right now. But
Yeah.
no, there's no magic medicine.
You probably have 3 or 4 houses if
I
you
might,
had that,
I might,
that
yeah.
kind of remedy.
So.
Excuse me. So tell me, what's the most common thing that you see with people? Because I know in my work, it's they won't wear their hearing aids. They
Right.
don't want to wear their hearing aids. So is that a really common problem
It is.
among people?
So I tell people 3 things about hearing aids whenever I'm talking to them after their hearing test. Number 1, I can't tell you that you need hearing aids. Much like glasses, people know they need glasses when they can't see to read or drive. Hearing aids are the same way. If you're having trouble understanding other people, we look at the hearing test, and depending on what your scores are, I can tell you, yes, they would help you have this amount of expectation. The second thing I tell people about hearing aids is, if you're not going to wear them, don't buy them. You know, for whatever reason, there's a stigma that they think hearing aids means they're getting older. I don't know why hearing aids have that stigma and glasses don't, but hearing aids do have that stigma. I wish we could break that. Hearing aids don't mean you're getting older. There are babies with hearing aids, and there are old people without hearing aids. The third thing is, like we talked about before, you get what you pay for. And so I try to steer people to call your insurance, see if you have any benefit, because a lot of times you don't have a benefit. And so they get blindsided when they come in and hey, I need hearing aids. Well, why will my insurance cover glasses and not hearing aids? And that's a hard thing. And I don't have an answer other than this is how insurance companies are. But, you know, we're here to help. A lot of times, if you do have a benefit, you'll need to find out where, because not everywhere will accept your hearing aid insurance. It's complicated. It's where they have their contracts.
I see.
But yeah, if we could get around the stigma, that would be a first thing.
The big thing
The big
is
thing.
getting past that.
It does not mean you're old. It just means you can't hear very well.
It just means you need a little help.
That's right.
Yeah, just like your glasses.
Just like your glasses.
Any other advice for people who are experiencing or have a family member who are experiencing hearing loss, other than we know the first step is making that appointment and coming in?
Yep. The first sign of recovery is admitting you have a problem. So,
Yeah.
So get them in and let someone with experience and knowledge and patience kind of counsel them and show them what's going on, and try to get them to understand it, as opposed to just throwing your hands up in the air and saying, I have hearing loss.
Well, and the quality of life will increase when you're able
Absolutely.
to hear, have better communication, be able to watch television.
Yeah. And it can help prevent, like we talked about, dementia and memory loss down the road. It's both for now and for the future. If you don't use it, you lose it. And so
We see that all the time in a lot of things.
It's better just to keep it working.
Yeah. Well, thank you so much for being on the show today. I know I've learned some things, and I hope our audience has learned some things. If you have any questions at all, I'm sure that you can call ENT Carolina and ask any questions that you'd like, and have them go over the procedures with you and all the services that they offer. I highly recommend being able to hear. Being able to see and hear are very important, and if you don't use it, you will lose it. So I hope everyone has a very healthy Merry Christmas and a Happy New Year. And thank you for watching Senior Moments. We'll see you back next time.